Welcome to My Trialist Trial Talk, Voices of Experience.
Hi, my name is Sabrina Martinez. I am 37 years old. I was born and raised in Brooklyn, New York, and I am a radiology technologist. I was diagnosed with adenocarcinoma of the lungs. I'm a non-smoker, by the way. Um, and I was diagnosed with cancer stage 3 when I was pregnant. I was 6 months pregnant with my second child, and he pretty much saved my life. And here I am today.
How did you feel about clinical trials before enrolling in one?
So when it comes to clinical trials, I look at clinical trials as a very positive thing. Why? Because it's something that they are running tests on. They're trying to figure things out to help other people. So whenever I hear about the clinical trials, I take it as a positive thing. Me as being in the working in the medical field, I had to go through my clinicals. So it's kind of like very similar. Like you have to go through these things to learn. You have to, make mistakes along the way, so that you can learn to better yourself. So I see clinical trials and my role as a radiology technologist, they're similar. So I appreciate it, and I take, positive thoughts to clinical trials.
What was your biggest concern about participating in a clinical trial?
One thought that always comes to mind is like, well, am I going to waste my time? Is this going to work? And you will only know unless you try. I honestly have not had any biggest concerns with any trials that I've been in. Why? Because I know it's going to be beneficial in the end to be a part of a trial.
Have you participated in other clinical trials in the past?
This is actually my second time going through treatment for the lung cancer. I also went through a clinical trial for, it was like this new blood test that was, um, it's fairly new. And what they do, they test your DNA in your blood to see if there's any cancer cells circulating. And I'm very lucky that I was doing those blood tests because they found the cancer. Um, After I did surgery in March, the first blood test came back normal, no cancer cells. The second blood test was 3 months after my surgery date, and they found circulating cancer cells again. So, which I was able to start getting on track and doing PET scans so that we can get me back on treatment. And it's happening again. But I'm very lucky that I was a part of the trial because who knows how long it would have been for me to find out that the cancer is back. And I say that because I have not felt sick the entire time that I was diagnosed with cancer. The only time I felt the illness was when I was on treatment.
Did your doctor play an active role in helping you find and choose a clinical trial?
So for one, my doctors, they're very intelligent. So whenever they bring forth information to me, I know it's because it's something that it's in the works. It's something that they believe in, something that it may work for many, many people. So we would just have casual conversation and they would tell me, hey, this is what's going on. Would you like to try? And I'm like, hey, absolutely.
Did you face any barriers when deciding to enroll in the trial?
So really the only issue I sometimes come um against is I have a 13-month-old. So finding, who to stay with the baby, or having to bring him to the babysitter, then coming to my appointment. So sometimes that gets a little difficult. So, that's one of like my difficulties I've had. And then there are times that I shouldn't be driving and I do drive. So that's also another thing that they said, if I need help with cancer care, that they would assist me with transportation as well.
What was the clinical trial enrollment process like?
I remember on the first day, I had a representative come in from Cancer Care. They went over the clinical trial process with me, and I just had to sign a few documents. So they made it very easy. And it, she stated that if I have any questions, I can always give them a call and they'll be available to answer any questions I have. Um, as for test-wise, there was nothing physical I had to do. Um, I think they really just did a blood draw. That's really what it was. Um, so nothing strenuous, and I honestly don't feel like I'm doing anything like physically for this clinical trial. So it's not, taking up any extra time of mine. And I think that helps out.
How did you find support throughout the clinical trial process?
My cancer care organizer, I guess, May Ryan, she is amazing at answering any questions I have, getting anything done I need. So I always contact her as well.
How important is it for you to advocate for yourself during treatment?
So as for me, I am very aware of my body. So I know when there's a change in my body. I know when something's not right. I know when something's slightly off. I know when I feel things that are out of the norm. So I am very, very vocal about telling, my providers, hey, no, this is not normal. I know myself. We have to do something. We have to check it out. So I'm like really big on advocating for me.
How did you take care of your mental health throughout the clinical trial process?
Definitely something that helps me is music. I listen to a lot of gospel music, and praying has helped me so much. I know I could pray a little harder, pray a little more, but that definitely does help. Um, and just trying to relax. Like, I'll go and sit in the shower and just let the water run on me. I may end up crying, but it's very helpful for me.
Was enrolling in a clinical trial the right decision for you?
Enrolling in the clinical trial, it definitely was the right decision for me. Me as a caretaker, I love to help, and knowing that my body, my mind, and my voice is helping other people in a similar situation, it's positive for me. It makes me feel good. Um, I am I always have positive thoughts about clinical trials because I know it's to move forward in the medical field or in whatever field that the clinical trials are happening in. So it's always positive things from me, and I absolutely know that it was the right decision.
What questions would you tell someone that is considering a clinical trial to ask their doctor?
I think when it comes to clinical trials, you want to ask your provider how far along is the company in the clinical trial? Has it been tested in other ways? Is it safe to test on people now? Those kind of clinical trials questions are good to ask your provider. Um, and you just have to always get the opinion too of the provider. See what the provider thinks about the clinical trial, because there's always more than one clinical trial out there. One may not work for you, but there'll be another one that would work for you.
How has cancer care helped you?
Cancer care literally has been like therapy for me too. They have offered therapy services for myself and my 14-year-old daughter. This is my second round of treatment, so for some reason my daughter is giving me issues. She's 14, so that's one thing in its own entity. She's a teenager and she has hormonal changes, and her attitude is just pretty much on 1,000. So they've given her services as well. So cancer care is not only there for the patient, they are there to support the family members, the children that are dealing with issues. They've also helped me. I wasn't working for 6 months when I did my treatment the last round. And they helped me with a backpack for my daughter, with a backpack for my stepson. Um, they did offer coats for my children. um, they've helped me fill out all kinds of documentation, which I honestly I don't have patience to fill documentation out, and I take really long. I am a procrastinator when it comes to things like that. So my cancer care representative, Ryan May, she's amazing, and she always helps me with all these things.
What advice would you give someone who is having a hard time deciding to enroll in a clinical trial?
You have to be able to have an open mind when it comes to being sick. It's like, do you stay in that same position or do you try something new? The new thing may not work, but there's a chance that it will work. And there's a chance that your body is similar to someone else's. So you have to look at it. Although you are sick, think that, like the way I think, my story, my body can help someone else. And if you have like humanity in you, if you have love in you, kindness in you, that it should just make it all more easier to say, yes, I'll join a clinical trial.
How has a clinical trial impacted your quality of life?
So, literally, when I found out that I was diagnosed with cancer, I was pregnant. So pretty much my baby boy, he is my lifesaver. I would have never found out that I had cancer because, of course, me being in the medical field, sometimes we tend to take long on getting health care for ourselves. I really never felt sick. I just had a really bad cough, maybe 3 times with from the time of I say 2020 to 2022 that I was diagnosed. So I tell my son now all the time, and I'm sure he mm, doesn't understand, but he will eventually understand how he is mommy's lifesaver. If it wasn't for my child, who knows? I most likely would have died of lung cancer. Um, he was a blessing to my life, and he gave mommy the strength to want to push through even more, and my daughter as well. I tell her all the time, like, I'm fighting this fight even stronger and harder for the both of you because I want to be here to, see my kids grow up. Like, the next big event is buying a home, which, like, we're in the process of doing that now. And I tell my daughter all the time, like, I can't wait till we get this home so that I could get you ready for your sweet 16 in 2 years. So it's definitely something to look forward to. Being on a clinical trial, it just makes me feel like I am fulfilling my purpose here in the world. I am here to help people. It makes me feel good to help others. It makes me feel like empowered, like I am doing something for my community, for sick people, for people that need a helping hand. I'm here doing that. So it's definitely empowering. It feels really good to be a part of a clinical trial.